can feel it. Let's see how the other side is. The other side's not too bad. It's just this one. Okay. Right now, as I'm just cleaning the area, I'm just using alcohol from L4. It's about L4, L5 where most of the problems in the back occur. He's got it on the side here. There's a muscle when he lifts his back up, you can feel it's extremely tight. When they do acupuncture, what they do is they find where the back of the vertebra here is, and then they go at a 45-degree angle. He, on the other hand, has the muscle a little deeper than that. Generally speaking, we don't always have to do the acupuncture point. We do the ashi. And the ashi points, just basically putting the needle and the muscle where it hurts. That's been described in the Huangdi Neijing many years ago, saying that the best way to treat things like this is if the bone hurts, you put the needle next to the bone. Tendon hurt, you put the needle next to the tendon. Muscle hurt, you put the needle in the muscle. The manipulation just helps it go in. Should you manipulate the needle? Some people will say yes, some people will say no. They believe that the electrical stimulation is actually better. I like manual manipulation. That's just personal preference. Electrical stimulation, you can just put it on and then walk away, but that's not a good thing. As my teacher once told me, when you put the needle in and you're moving it around like that, it's like basically putting a chopstick into spaghetti. By doing so, it moves the muscles, it moves the fiber out of the way so you can put the needle in. The needle tip itself is dull, so it's not like a very sharp object. Even any of the fibers or something that's actually hard in there will start to just move out of the way. So with manipulation, all you have to do is move it back and forth a little bit. They call it regulating. It's not really a technique. What you're doing is you're trying to get, what they want you to do is try to get what they call Da Qi, or the Qi reaction. It's hard to see in here, but I can see some of it already. It's like a small circle around the needle. This one has it, this one has it. This one's starting to get it. And by doing so, it just helps to relax the muscle a little bit. You don't have to put 50 needles into someone. Even just, if it's just on one side, you want to put a couple of needles on the other just so you can keep the whole thing balanced. For some of the older theories in relation to, let's say, yin-yang acupuncture, the needles technically should have been taken out by now. It's been more than 7 seconds. There is a thought between doing the manipulations and how many breaths you take, and that's the point where you take it out. But for with this type of problem where it's a muscle problem, you can leave the needle in for a little while longer. And the only reason because of that is the needle itself is just relaxing the muscle. And the more that the muscle is relaxed, the more blood flows through it, the better it is to relieve the pain. A lot of people have all these different type of explanations of how the needles work. You know, they talk about GABA, they talk about all these other gaseous things that are released, and most of it's just not true. When we're talking about back pain in particular, there are a lot of reasons, but acupuncture works very well with muscle-related problems. It doesn't just have to be the back, it can be the legs, the knees, the arms, shoulders. It also works very well with tendons, so even with the area surrounding the vertebra. You know, you're talking not so much as the cushion between it, where people are getting like bulging discs and stuff like that. That in itself needs to be manipulated back into position. Once it's manipulated back to position by like a physical therapist or a chiropractor, then you can use acupuncture to strengthen the muscle just to keep the vertebra in line. That in itself is good too, because you don't want the disc to slip back out again. You can just use some people say tonification, some people say reinforcing, some people use strengthening. You know, you just give them a treatment just to make sure the muscles relax. It makes the muscle a little bit stronger, and then the physical therapist usually gives them some exercises or something to do to build the muscle back up again. Generally speaking, when you're going into treatment, one of the things you want to look for is the practitioner itself should ask you a lot of questions. They should talk to you and see, you know, how you got the problem, where the problem's located. They should do palpation on the area. Usually they'll do the tongue, they'll do the pulse, which is the way that Chinese medicine does diagnosis, but 9 times out of 10 you really don't have to do that with back pain. And right there people are like, no, that's wrong, and it is and it's not, because you already know the patient's in pain. You already know that, you know, he might have a choppy pulse, he might have a purple tongue, which are all related to stasis and stagnation. But most of the time people are actually in very good condition, except for stasis and stagnation. They're sitting at their desk all day, they're not moving around. Basically they're getting hurt doing exercises, they didn't lift up weights correctly. In my case, when I was doing Kung Fu yesterday, I got thrown down on my knee, and now my knee hurts today. It's a little bruised on the inside, but it's not too bad. With these type of things, you really don't have to do acupuncture. There are other little things that you can do, such as my good friend Lee from Lake Park Kung Fu, he sells the Didajiao, that they use for putting on bruises and things that you do when you get hurt. There's also Tuina, there's the Chinese massage. That in itself is also good to, you know, break up any of the tough muscle fiber, or try to get the blood flowing through the back again, or the arm, or wherever it hurts. There's also cupping, which a lot of people have seen lately, especially with some of the celebrities. That's one of the nice things. Those are the huge bruises that they see on the back. What they do is they take a cup. There's fire cupping. They will put it in there so it creates a suction. But nowadays we have plastic cups that we just, you know, suck up the air from the inside. But they'll have an oil on the back too. So you can manipulate the cup so that it goes up and down the back along the muscles. And yeah, it gives you a nice, you know, long purple streak, but it works just like massage, or a very heavy massage. That also is very nice to do. Acupuncture, I think, is very good when you have like a deep down muscle pain, like the whole thing is tight like a rock. And even when you put the needle in, you can feel it. It feels like it's scraping against stone. You can actually feel that, like if you scraped it on here under your thumb, you could feel that hardness. You could feel the texture underneath. You don't want to push the needle straight in. That's where the manipulation comes into play. The manipulation itself will start to relax the muscle a little bit. And then again, as my teacher said, it's like putting a chopstick into a spaghetti. Basically everything just parts out of the way. You're not trying to break everything up, you're just putting the needle in and just letting everything flow around it, so it becomes unbroken. When you take the needle out, it just comes back again. If you're forcing the needle in, you're breaking everything up, and that's no good. Some people were asking me about the manipulation. As I said before, that was more of a reinforcing technique. There are really two specific techniques that they have. I believe it's fire on the mountain and freeze on the heaven. Basically, it's just another way of tonification. Tonification and reduction. Tonification is for trying to strengthen. The reduction is trying to lessen it. And there are two basic thoughts on that. First, you have the clockwise, which is for tonification. You have the counterclockwise for reduction. A lot of the old books, there is no dependent on twisting of the needle. What they say is heavy in, light out, or light in and heavy out. And that is where they got the general idea of, you would pull the needle in and then quickly put it back. Slowly pull it out and then put it in. There's been some interesting theories about this, though, as they say that the heavy in, light out is not supposed to be the needle, but it's supposed to be related to the hole. What happens is once this receives the qi, after you take the needle out, the heavy in, light out is talking about how fast that you actually cover over the hole. For example, heavy in, light out is putting the needle in, letting it sit for a while. But as soon as it's done, take the needle out, cover over the hole. This is their tonification method. What they're trying to do is they're bringing qi specifically to the area. Once you take the needle out, you want to close over the hole so the qi stays in the area. This gives more focus on the point. It gives more focus towards whatever the function of the point is. Now, light in, heavy out, the reduction is actually used more for colds. Basically, there are 4 different levels within Chinese medicine, the Wei Qi Yin Shui, the skin level, which is the Wei level, the Qi level, which is a midpoint, the Yin, which is the nutritive, I think it is, and the Shui, which is the blood. Now, the blood is the lowest level. Saying that a disease gets to the blood level basically does not give you a very good prognosis. But having the cold on the Wei level or the skin level, keeping the needle up on top, just manipulating it, you want to bring what they say the pathogen, you want to bring the disease up to the top. Soon as you let the needle out, you don't cover it because you want the pathogen to be released. Some people will say that's kind of funny, it doesn't make any scientific medical sense, but when we talk about colds, when we talk about what we call wing cold, which is like a general cold, they say that there's the disease itself is trapped within the skin. So our idea is if we bring it to the skin and open it, we let it disperse. It works the same way as like sweating. Basically, if you have a cold, you drink something that makes you sweat, you get under the covers, and then after a little while you could feel better. It always depends on the type of cold. But these are some of the different manipulation techniques that they talk about in modern Chinese medicine and postmodern Chinese medicine. Now, some people worry about bleeding. And as I said, the chopsticks into the spaghetti method works very well with this because you won't see almost any bleeding at all. Now, you might see some if the person had any type of bruising or whatnot, but generally speaking, it all turns out pretty good. So after you take the needles out, it's always good to do some type of other manipulation, whether it be the cupping or the tuina, or even finding, like the diadajo or the patches that you can use, you can put up right on top of it. This just extends the relief that the person gets throughout the day. And this would commonly be a normal acupuncture treatment. You would come in, you would speak with the practitioner, you tell him your problem. He'd ask you a few questions in relation to it. He'll ask you a few diagnosis questions. He'll come up with a treatment, a diagnosis and a treatment plan. They would bring you into the room. He would palpate a little bit, try to find where the pain would be. They do the cleaning, try to find the points, put the needles in. They'll manipulate it once in a while, take the needle out. They'll let you sit for a couple of minutes just to make sure that you're feeling okay. And then after that, they will do, again, the tuina or cupping or the patches. And if you need to, maybe he'll also give you some herbs. And then, depending on your thought, most people usually don't come in until the next week, but it's always better to get acupuncture in succession, like every day, if you can. You'll find that acupuncture works better if you're doing it like 5 days in a row, as opposed to 5 weeks in a row. But some people, their schedule just doesn't allow them to do that. There's more theory as well behind that, but in a general sense, in a general practice, this is just the way they do it.